I'm joined now by Dr. Mario Strazzabosco and Guadalupe Garcia-Tsao, both from the Yale School of Medicine Liver Center. Thank you so much for being here. And one of the sessions I know you are moderating together is about value-based medicine. Can you talk to me about that concept and how perhaps really the focus has been lost in many ways?
Well, I guess it has been lost. As healthcare costs, no matter how many healthcare reforms there are and so forth, healthcare costs, specifically in the U.S., has continued to go up and up. We have all been focused on reducing costs, shifting costs, limiting resources and so forth. And we as doctors, our main focus is to focus on the patient, on the quality of care, on the value to the patient. And if we can provide value care to the patient, almost by definition, the cost will go down. So this all came from groundbreaking work from Drs. Porter and Theisberg from the Harvard Business School. They decided that what we really have to do is provide value for healthcare, and value has to do with health outcomes. It's not just cure this disease, but also the patient's quality of life. And as this happens, the competition then has to be based on the results of the doctors or the centers rather than on how cheap the care is or how not cheap this is. It's essential then that we have to be able to measure outcomes and that these outcomes are open to the public. So if this is widely available, then this will drive competition.
And if you're providing that value, patients are going to feel better in many ways, I'm sure. You did a study at the University of Milan, and you're going to try to help us to benefit from that. Can you talk about some of those results?
Yes, when I first heard about this theory from Porter and Theisberg about the value-based medicine, and I tried to promote it around with my colleagues, the first reaction was that it's a good theory, but it's not feasible, because we don't have the outcomes value. We don't have the indicator to measure the outcome. It's going to be difficult or impossible to do so. And so, as all scientists do, we did an experiment. And the experiment was try to decide through different focus groups what the outcome would be, and then to test them in practice. And we choose Italy because it's simply a more simple system. It's a single-payer system with universal access. And in Lombardy, there are very good healthcare and hospitals, so we were able to define a set of indicators and to test them in the field. And we were able to give some numbers to the indicators that we designed. So this is what we are going to talk about what these outcome indicators can be for the different liver diseases.
And communicating that success, what do you ultimately hope to achieve, or what message do you hope to leave people with here?
Well, the first thing is that it is possible to measure the outcome indicators. They are there, they are viable, it's not that difficult, and by the very same action of measuring them, you are improving healthcare. Because when you know the numbers, you know the data, you know what you're doing, you immediately implement improvement actions. And we want to show that it is possible that physicians get involved in the debate about sustainability of care. We have been absent from this debate, and it's our own responsibility to decide professionally what are the relevant measurements and to work with our patients. There's a strong alliance between physicians and patients in making healthcare sustainable.
And clearly it will benefit not just the patients, but the physicians as well. Thank you.
And the society.
Yes, thank you.